Welcome to the Silent Epidemic by Omnia Therapy. I'm your host, Hatice Mehmet-Quirk. Today I'm joined by Dr. Tony Tan, a clinical psychologist and CEO of Treehouse, Thailand, an award-winning rehabilitation centre. With over 14 years of experience in mental and behavioural healthcare, Tony specialises in trauma, addiction and complex mental health presentations, including dual diagnosis, personality disorders and dissociation. His work integrates a wide range of approaches, including EMDR, Brainspotting, clinical hypnotherapy and mindfulness, allowing him to support even the most complex and treatment-resistant cases. Tony, welcome to the show. Let's start by exploring what led you into working with trauma and addiction at such a deep level.
All right. Thank you for having me here. It's quite an honor. Let's talk about how I got into this work. Actually, I'm a recovering addict myself. I'm 22 years in recovery from drugs addiction. And possibly I would say that really influenced me getting into this industry, training as a psychologist. And in my work, I would say, I started with addiction in my early stage of my career, addiction counseling. And in the work that I do with addicts and treating addiction, I start to realize that it wasn't a standalone issue. There are much more complexity. And I also noticed there's a trend of people relapsing after treatment. And it got me wondering, I say, is there something that we are not looking at? Is there something that we are missing out? And as my training and education as a psychologist, I start exploring is like, beside addiction, what are we missing here? And that really leads me to explore trauma as an area that I start developing, working on since 2014.
It's really interesting actually because it's quite a refreshing way of looking at it, that understanding that it's not usually just the addiction that a person can be battling with and that there's underlying causes, and trying to understand how those underlying causes can be linking in and causing the relapses, and working to develop and support the individual around what they may be experiencing, rather than expecting the individual to just fit into a treatment plan because they're dealing with addiction. You look at the person as a whole holistically.
Yeah, I would say treatment with addiction, or it has evolved a lot, over the years. I enter into this field of work with addictions in 2010. I would say today, 2026, the treatment model has evolved a lot, especially with dual diagnosis and things like that. We need to look at the person more and more as a whole. Okay.
Was there a particular moment or experience that shaped your clinical direction?
I would say in the early days of my addiction work, I have noticed that people somehow keep relapsing. So after they complete treatment, they will relapse and they come back to treatment again. So it becomes a cycle that they are so used to it, they are stuck in it. And that really got me to start thinking, is there anything that we are missing out? And that was when I start exploring, researching, and I come about Dr. Gabo Mate work in trauma, and that really was a light bulb moment for me. And that was when I start exploring, diving deeper into trauma training and understanding, and that was how it become a very important moment of my career, where I start shifting from not just addiction work, but I would call it dual diagnosis, exploring childhood trauma or even PTSD related.
Yeah. You specialize in some of the most complex presentations, dual diagnosis, dissociation, personality disorders. What drew you toward working with these challenges?
It's helping the clients, the individual, to really reach a point of resolving their issue and seeing how their life transform after their trauma, uh, the issue has been resolved. The way I look at it is childhood trauma is really the invisible architects of adults' life, the way I describe it. It affects the nervous system of that individual. So, example, if we are in a high heat environment or high stress environment, and our body is always in that fight and flight, so-called movement for decade, and a person, of course, their mental health, their nervous system breakdown, and seeing them through the work that we do with them, helping them to start getting control of their life back, their nervous system start getting regulated. I think that was really the deciding moment that in my career that perhaps we are doing something right and getting the proper treatment or effective treatment for them, you see.
So whilst you can see the impact of having these presenting issues for the client can be quite big, helping them to understand how that impacts them and how that impacts their nervous system and helping them come to terms with how to manage that helps them sort of come through the other side and give them the fruits of their labor. And as a result, that was your driving force to really help empower people through that understanding and support.
Exactly. I think you near it that way. And you see, a lot of time we look at addiction as addiction standalone, and I kind of always say addiction is almost never the primary problem. It is a desperate secondary attempt to medicate the primary pain that they are carrying. And where does that pain come from? A lot of time it originated from childhood, parental issue that has never been resolved. And that individual was always in that stage of deregulated and trying to live their life and trying to be normal. Of course, we know they can never attempt to achieve that, you see.
Yeah. I mean, it's really difficult, isn't it, to try and reach that state of normal, if you like, when you've never known emotional regulation and you've lived in a dysregulated state from, as young as you can remember. Trying to find that balance on a dysregulated emotional framework isn't going to happen, is it?
Yeah, I think that was really the crucial turning point of seeing people do get recovery. They do get well. I think that was really the motivating factor in the work we are doing. Yeah.
I think there's also been a shift as well, isn't there, in terms of understanding that people don't go to rehab for 28 days and then just get well. They don't just recover. It's a life-changing commitment to a new way of being that's going to support them and encourage them to remain sober with this new information of understanding what the trauma is and how that's impacted them and giving them this new way of being in an emotionally regulated state.
I mean, if you really look at rehab in the old days, a lot of rehab center, we adopt the Minnesota model, which also include 12-step approach as a treatment, as part of the treatment. I mean, isn't that 12-step doesn't work, but why do people keep relapsing? That was the question I asked. Even myself, I was associated with 12-step NA recovery in the very early days of my journey. early recovery. However, in my early stage of recovery, I was carrying a lot of pain, you know, a lot of my childhood issue, memory, parental issue with my own parents has popped up. And I was trying desperately to get well, to get clean, 12 step does help me a lot in my early days. I'm
Yeah.
not going to discredit it. It has its
Yeah.
effectiveness, but somehow it doesn't eliminate those pain or from childhood that still is still in me. And that was when I start working on it, working on myself, through my own therapies of in my trauma issue, and using EMDR. That really made a big shift for me.
Nice.
And you can say it's for the first time in my life there's a light in the tunnel. I could see
Mm.
sense of relief. And that was when I realized if you are treating addiction as it stand alone, it's probably insufficient. You know, it
Mm.
does get a person well, clean, sober, but it doesn't really go down to the root cause, the pain they are still
Yeah.
carrying. And for many people, those pain that they are carrying is really the trigger for a big issue or trigger for their relapse, you see. Yeah, because remember, addiction is a way we use to medicate the pain. It's not
Of
just,
course.
using too much or drinking too much. That's simple,
Yeah.
right? And that's why people are stuck in that cycle because addiction does
Mm.
help. It does serve a
Mm.
point. It take
Mm.
away that pain, it numb the pain. But of course, we know that it has lost its usefulness as they
Yeah.
begin to start using more and drinking more or even acting out in other area. And that's why I would say in today's
Causing more
context,
problems to the original problem, right?
exactly. Yeah.
You've spoken quite a bit today as well about how early childhood experiences affect an adult in later life. That's probably where the root of their problems come from, the trauma and their childhood experiences. How do you feel that those childhood experiences shape an adult's mental health and behaviour?
I would say it definitely play a very significant role and
Mm.
impact. I mean,
Mm-hmm.
if you look at mental health, a lot of it is caused by distress. It's not just stress. Okay, we're
Mm.
talking about distress at a long period, over a long period of time. And when that distress is not being resolved, our fight flight system are deregulated. So the nervous
Mm.
system breakdown, distress increase, and that really develop or it goes into some form of mental disorder, depression,
Mm.
anxiety, OCD, or to certain extent personality disorder, or even bipolar disorder.
Mm.
Some got into addiction, you see, and that really is you can see that link over there. It drive a very
Mm.
significant impact on the person mental health, you see. So without
Yeah.
resolving the childhood issue that has been lingering around for ages or decades, you're really not going to get any significant result
Yeah.
from any form of treatment that you are doing it. And you can't keep medicating that person, you see.
Mm.
I mean, sometimes I'm quite shocked to see a patient or my client that comes to me, they are on tons of medication.
Yeah.
Why? Because I mean, they can't eradicate the problem. They
Mm.
just keep treating the symptoms, and over a long period of time, the medication just get more and more heavier doses
Mm.
or even heavier medication they need or require. And it's quite sad to see them in that condition, you see.
Yeah, and it's quite sad that more people don't have the outlook that you do in terms of let's get in to treat it. But then also you get some cases where clients don't want to address those issues. They're not ready to. They're scared to.
Who agree they are scared because they don't know what they are going to face. Okay.
Mm.
I mean, all they know, I mean, let's be honest, taking a pill or taking a medication, you get a faster result. Right?
Yeah.
So you let's say example, I experience anxiety right now. Okay, I'm going
Mm.
to take some medication, a benzodiazepine. which medicate my anxiety. In 20 minutes to 30 minutes time, I'm going to feel numb. I'm going to feel calm. So it's an easier way out. Whereas therapy, trauma treatment, you really need to face it. You need to work hard on it, and it's not going to take effect immediately. The effect, the changes, the healing does come, but after some work that you do with it. So medication would still be a easier way out for people. I would say with increased education, awareness, understanding, I do hope, or I do see people more receptive to this kind of treatment rather than just using medication, you see.
And I always say to clients, short-term pain, long-term gain. It may be difficult in the beginning, or it's going to be difficult if you're going to the root cause of the trauma. However, you're going to have that long-term freedom from that pain for that, that short period of discomfort while you explore it.
Yeah, I do agree. In today's, I would say, as more awareness in terms of how this type of trauma treatment combined with addiction treatment is evolving, or even trauma and mental health, which is an area that we are working on. People are become more receptive. We do have quite a group of clients who want to look for such treatment rather than just medication. And we often say medication does work, does help, but it's not a long-term solution. It stabilizes you, but during that stabilization, it will be great that you really go down to work on yourself, eradicate the root cause of your issue, and that does help, with more sustainable recovery or life-changing, future, you see.
You work across all forms of addiction. What do people often misunderstand about addiction?
What people often misunderstand about addiction, that's an interesting way to look at it. Uh, they believe that if they can stop, everything will return to normal. You know. However, what do we mean by stopping? What do we mean by recovery? That is something that they could not comprehend. So to an addicted person, they will say, if I could stop, it would be as per the normal. It would be like before. So I think that is a big misconception.
And how do family dynamics and relational patterns influence addiction and recovery?
I would say family actually play a big part, in, I would say, in treatment of addiction. Put it this way, I give you a way of understanding. Let's say we have a fish tank that need to be cleaned. We can take out the fish, clean the tank without changing the water. The water is still dirty, and we are going to put that fish back into that environment. It's still a dirty tank. Nothing changes, even though we attempt to clean it. So we really need to change that water, make the environment conducive again before we put that fish back so that they can function, they can survive. So family play a very, very critical role. They are the other hand that support that individual. So without involving the family, it's really, I call it the cake that is half baked. Because if we were to ask that individual in recovery, going back to their environment and trying to make it out on their own, that would be a very tall order for that person who just getting into recovery, and they are trying to do everything right, getting the support they need. When they don't have even their family support, it could be quite detrimental. So I would say family support really play a crucial role.
It does really play a crucial role, and I suppose but I think on the flip side as well, it can be really difficult for the families as well, because I always feel like addiction is the type of mental health issue that doesn't really get enough support and understanding, because, you know, people that haven't walked down that path have this attitude of, well, you just stop, you know, they're selfish, they're drinking too much, they've got a choice, etc., etc. But sometimes the family has been so hurt by the behaviours caused by the addictive patterns that are going on, can be really difficult for them to realise that they have to put more effort into helping and supporting that person for change to happen.
Yeah. Okay. Put it this way: the individual need recovery. The family who are impacted by the person addiction, they need recovery as well. You know, it's both way. Both
Yeah.
need healing, both need recovery. And we are not asking that the family give up everything to how you say, to support that individual, but in a way both of them find their own recovery and they can kind of support each other. I call it interdependent, not codependent. Okay, codependent is another form of addiction, but in recovery we call it interdependent. Both are dependent on each other for their recovery, and if we can build that support system for both to support each other, I would say you are going to get very good result for both ends, the individual and the family. Yeah. Okay. You see, healthy relationship within the client and the family is also provide accountability and emotional safety. You see, so the recovering person, are able to be accountable for themselves, to the family who hold them accountable, and yet in that interdependent state where they help each other, the emotional safety is established. And don't forget, addiction really uh, damage the emotional part of both ends, whether it's the person or the family. But in recovery, that was when the emotional healing was formed and the safety net for both was also established. They're learning to trust again, and that is the crucial part.
You've played a key role in developing multiple rehab centres. What defines an effective treatment environment?
I would say I helped build a lot. I was involved, I would say. I have the honor to be actively involved in the work of, I would say, 3 rehab center by now. I would say what make effective treatment, the environment play a very crucial role. You know, I call it the environment is the third therapist in work. Okay, so we have the therapists themselves, other therapists in the group, doing group work with the clients or other holistic practitioner. Then the environment is actually itself is a third therapist. Okay, it's a very subtle form. Okay, of when you are utilizing nature in your treatment, it actually provide a very calm and soothing, recovering environment for the person, you see. And that soothing nature, it help the sensory input to naturally lower the cortisol level. And when that are lower, the person feel calmer. They are not so agitated or on the edge. And that really, also release the fight flight system in that person, and that really make the treatment much more uh, conducive, you see. So environment play a critical role, and then also the psychological safety aspect of that is very important, especially in the work we are doing with trauma. So once they step into this environment, they must feel like they are in a safe space, and we are holding it for them. So that really make a, how you say, a critical factor. Okay. And then also what we do is I call it we eliminate the production line treatment, the one size fit all, treatment model. Yeah. So we have this, we call it the core therapy and
Mm-hmm.
the flex therapy, flexible therapy.
Nice.
So there are core therapy that they need to assess, okay,
Mm-hmm.
like group work,
Mm-hmm.
you know, breath work, holistic group, yoga, mindfulness, uh, sound therapy, music therapy. So these are
Mm-hmm.
core. However, we also have flex therapy, okay,
Mm-hmm.
flexible that they can choose. Okay, like some people would like how you say art therapy. They are more into drawing. They are more into, let's say, handiwork like pottery, or they even like dance. So
Mm-hmm.
we will incorporate that. So those are flex. Like example, I have a client who really like gardening, and that really
Nice.
help him. Touching the
Mm.
soil, that sensory input help to calm him down, right?
Lovely.
However, not everyone is into gardening.
No.
Some people doesn't want to be in the greenhouse sweating. They don't like to get their hands dirty. And I have another client who like aqua therapy, who like, doing
Mm.
some body work, aqua therapy in the pool,
Mm-hmm.
and we can
Mm-hmm.
actually cater to different needs within the
Yeah.
same treatment environment. So I would say the
Nice.
environment, the psychological safety, and also the uh, kind of tailored therapy
Mm.
model that
Mm-hmm.
we can cater for the client. This really does make a lot different for the treatment to be effective, you see. Yeah.
Tony, thank you for sharing your expertise and your insight. Your work highlights the depth and complexity of trauma, but also the possibility of healing, even in the most challenging cases. Before we close, what final message would you like to share with listeners, particularly those who may feel like they've tried everything and nothing has worked?
All right. Okay, to the person that you felt that you have tried everything and still feel in your recovery, you have not make it, I just want to say you did not fail. The method that you are using may not be a language that your nervous system could understand. Okay. Healing is not about becoming a new you. It's about removing those layers. So today you may want to consider exploring like beyond your addiction. Is there any trauma that you are sitting on and you are not dealing with it? Perhaps it's time. And don't stop searching for recovery.
Nice. That's a really nice message to our audience. Thank you for joining us on the Silent Epidemic. If this conversation resonated with you, please like, share, and subscribe. Join us next time as we continue exploring the reality shaping mental health, trauma, and recovery. Thank you so much.
Thank you.